Hello doctors, welcome to this new episode. In today's video we are going to discuss about the roles and responsibilities of the general practitioner. Before entering into this video, which is a document which we need to refer before applying for any exams here. Are we eligible here? What are the requirements? You should see this PQR document, which is called Professional Qualification Requirement, which is the Unified Healthcare Professional Qualification Requirement. This document you will get in the online. I will give the description in. I will give the link in the description. You can download and you can read. This will contain all the information, all the doubts. What are the exams? What are the required experience? What are the CME credit points which we require? Everything will be you can find in this document, Unified Healthcare Professional Document. Okay. So first we will start with the general practitioner. Who can apply for the general practitioner? This is the first topic. So here, and what is the minimum experience required for the general practitioner? Here you will see any MBBS doctor who has finished his 2 years experience, he can apply for the general practitioner first. Second thing, any diploma candidates, most commonly the DCH and DGO candidates with they do not need any experience because they have already completed the 2 years of experience of post graduation. They can apply for the general practitioner license, but they will be eligible to work in the pediatric or gynec department. And the third category will be the MD doctors who has less than 3 years of experience, can apply for the general practitioner and can work in the respective department. And same, this will be more commonly for the pediatrics and gynec, which is OG, and maybe anesthesia. These three departments are more common, and even if you have MD emergency medicines, they might work in the emergencies. These are the more three common qualification required to work as a general practitioner. Okay, and the second will be what are the most common department and GP can work. They can start from the emergency, they can work in the emergency. Most commonly the people will work in the emergency. They should have a good experience in the emergency, base knowledge, good qualifications, and they should complete their BLS, ACLS and PALS, whatever it is they should complete for this emergency. The second will be the pediatrics. They will have the term as a registrar, and the gynecology, surgery, internal medicine, ICU, PICU, NICU and ward doctors. These are the departments where a general practitioner can apply for the post, and depending upon their experience, depending upon their external extra qualifications like the diploma degree or MD degree, they can apply for the general practitioner. So what is the role of a GP doctor in hospital? There are GP can work in two places, either it will be work in the hospital or clinic. So both of them have a different working pattern, different roles, different privileges will be there. So here the role of GP in hospitals. A GP or general practitioner will be more like a duty doctor in the our Indian hospitals, or like a post graduation medical college where they will be working as around the clock 24, not 24, 12-hour shift or 8-hour shift, and they will be reporting immediately to the immediate specialist in the respective department. If a GP working in the pediatric department, he will be reporting to the immediate pediatric specialist. If he is working in the emergency department, he will be reporting to the immediate emergency specialist. If it is a gynecology department, he will be reporting to the gynecology specialist. If he is working the ward as a ward GP doctor, they will be reporting to their surgeon or the internal medicines. They will be reporting to it. The same way, it will be the ICU, PICU, NICU, CC, whatever it is. If the GP works in the respiratory department, they will be reporting to the cardiologist or intensivist. What is the main thing? The general practitioner will not have any admission rights, will not be there, because they will be like a duty doctor, and they will have the night duties. It will be like minimum 8 to 10 night duties in a month will be there for the general duty doctors or the general practitioner. They should have a good basic knowledge and clinical skills, because the fresh candidates or MBBS candidate cannot work directly into a general practitioner. They should have a 2 years of clinical experience. Even though you require 2 years of clinical experience to get the license for general practitioner, to get into the hospital, to be recruited by the hospital, you should have good basic knowledge clinical skills, because you are the first point of contact in emergency department or the trauma or medical emergency, pediatric and gynecology emergencies. So in this department, unless you have a thorough good knowledge and the clinical skill to diagnose who is sick and who is stable, you should know all these things to be get recruited, because you will be responsible for that patient to discuss with your immediate specialist on the duty, to discuss the clinical case. In the night duty, the specialist will not be there in the hospital, so you should be discussing with these cases with the specialist. So the clinical knowledge and the clinical signs and symptoms should be perfect to discuss, so that the specialist will be able to take a decision whether to admit or triage away or treat, or what are the medications, so that the knowledges and clinical should be good if you are working in this department. If you are working in the ward, okay, that's, you do not have that much clinical experience, but you should have a basic thing. And what are the other roles? The doctors will be the general practitioner, they will be attending the routine ward rounds, the deliveries in case of pediatrics or gynecology, and assisting the surgeons in the routine ward rounds and writing notes, prescribing the medications, preparing discharge summaries. All these things will be the other routine roles and responsibilities of the general practitioner. And the GP posted in the ICUs like PICU, NICU, post-op ICUs, they will be working under the specialist intensivist, and they will be under supervision, and any basic emergencies they will be intervening the patients. And major thing, any patient who crashes in the hospital, the general practitioner do not have the privilege to intubate or ventilate the patient. They should call the code blue, they should call the code blue, and the intensivist or the anesthetist or the pediatric specialist who is on call, who is designed for the code blue team, will come there and they will resuscitate the patient. But to recognize, the general practitioner has to recognize it, and basic they will be in the team, the general practitioner will be in the team of the code blue, and they will be managing the patients. But ventilating a child will be more of a teamwork with by the anesthetist, will be who will be intubating the patient on that day if it is a code blue. And other thing is routine treatment. This general practitioner can take minor decisions, but they will be discussing with the specialist and consultant to what is the next plan of care, what is the next treatment what should do. So this is the rough roles and responsibilities of a general practitioner, either if it is a MBBS or the diploma with the experience, or the MD without the experience, less than 3 years of experience. They will be going through all these scenarios. Can GP work in a clinic? Yes, of course, the GP can work in a clinic, a GP licensed doctor. It will be like a OPD practice. And same, they will not have any night duties when you work as a general practitioner in a clinic. And it is a like usual clinical practice which you practice in India, where you will be seeing a patient, prescribing medicines, discharge the patient, and if it is a critical case, you can refer to the specialist, nearby specialist, or nearby the hospitals. And mostly it will be polyclinic, because not there won't be any single clinic. They will have mostly polyclinic, where all other departments will be there. If you do not know what to do, you can always refer this patient to the nearby specialist, so that they can take a better decision for the patient. And the GP do not have the admission right. If you want to admit the patient, you should refer to the nearby hospital, and that patient will be admitted under the specialist who is called the MRP, which is like most responsible person. This we will discuss later under topic specialist. So obviously they will admit under the specialist. You don't need to worry, send this patient, refer this patient. The management operations will take care of referring the patient to this respective hospital. Majority of the clinics will have a tied up hospital, and they will take care of the admission. After discharge, they will come to you to follow up on the patient. So what is the working hours in a week? How much work hours? Roughly all the departments, all the GP specialist consultant will have the 48-hour shift per week. In a week, it's only 48 hours, not more than 48 hours you need to work. So in hospital, in clinic, there are two different things. In hospital, you will have a 12-hour shift or 8-hour shift. If it's a 12-hour shift, you will have a 2-day duties, 2 night duties, and 3 days of off. It's quite simple. So 12 hours, 12 hours, 12 4s are 48, and 3 days off you will get. Most is 12-hour shift. and night duties will be there for the general practitioner. You cannot escape from the night duties. In clinic, no night duties. It's a straight shift or split shift. It will be like 6 days of work and 1 days off. Either you will have a 9 to 5 duty, or 1 to 9 p.m. duty, or it will be a split 9 to 1 and 5 to 9 p.m. duties. These are the three types of clinical practice shift. But whatever it is, you will get a 1 day off. Either it will be on Sunday, Saturday, or Friday. That depend upon the hospital, the clinics. Depending upon the clinic, same ways in the hospital, off will vary. Either you will get off on Sunday, Saturday, or Friday. It depends on the duty manager who puts the duty rota for the general practitioner. So, what is the expected salary in clinic? It depends upon the management, hospital, clinic, nationality, extra degree. It stands anywhere between the 8,000 to 12,000 if they are a GP doctor in clinic. What is the expected salary for a GP in hospital? Here comes a different catch, because it's difference between, if it is a plain MBBS, a different salary. If the diploma, they have different salary, and if it is a MD or MS with less than 3 years of experience, they will have a different salary. It depends on the several factors. Depending on hospital management, it is the Indian management or Western management or Arabic management. Indian management will have a lesser salary, Arabic and Western management will have a little bit more salary. So same, MBBS, diploma or degree, and the department. If it is emergency, different salary, ICU, different salary. On a rough basis, if it is an MBBS doctor who works in a ward or emergency, they will roughly 15,000 plus or minus. The salary is a rough guides. You cannot go completely with this exact numbers. It's a rough idea I'm just giving you. Second will be the diploma candidate, like if a DCH or a DGO, they will earn anywhere between 18 to 25,000, that too depending upon the hospital in which you are working. But average will be the 20k AED plus or minus. If it is an MD with less than 3 years of experience, they can work as a GP. Their starting salary anywhere between the 20k AED to 27k AED. You can get sometimes 30k AED in some hospitals, but on an average 20 to 25 you will get as a MD with a general practitioner license. These are the basic thing about the general practitioner.